Hello, it's Carl Lishing, licensed insurance agent. Today, we're going to talk a little bit about the pros and cons of having original Medicare with a supplement, a standalone drug plan, and standalone dental and vision product versus joining a Medicare Advantage plan. With original Medicare, there are no networks. You can go to any doctor and any hospital that takes Medicare. So all the claims go to Medicare and they pay as primary. Historically, the way Medicare pays claims is they look at the billing codes submitted by the healthcare providers, and if it's a Medicare covered expense, they pay, and they pay pretty freely. They don't ask a lot of questions. Starting in 2026, Ohio is one of, I believe, 6 states that is starting to implement prior authorization with original Medicare. They're starting off with 17 selected Medicare services and procedures. Depending on how that program goes, it might get expanded, but managed care is starting to come to original Medicare. We'll see how it develops over time. Now, when you have original Medicare, most people are going to get a Medicare supplement to cover the gaps in Medicare. And you pay additional premium for that. And depending on which plan you have, it'll cover the cost sharing on original Medicare. If you have a plan G, there's going to be very little out-of-pocket expense. Plan N will have a little bit more, like copays after the Part B deductible. Those would be the 2 more common ones. So the claims go to Medicare first. The supplement automatically fills the gaps. There's no networks. Then you buy your drug plan separate. And if you want dental and vision, you buy that separate. Now, Medicare supplement premiums themselves, they're on the rise. The last couple of years, we've seen larger increases than we've seen in the previous 10 to 15 years. So people are starting to feel the financial pressure, and they're starting to look at Medicare Advantage a little bit closer. So when you look at Medicare supplement premiums, depending on your age and which plan you're enrolled in, premiums can usually be anywhere from $150 up to $300, give or take a little bit. Medicare Part D for prescriptions, historically there's been premiums as low as $0. Some of them up around $100 a month. Dental and vision products, they usually go between $40 to $60 a month per person. So when you start adding those things up, the Medicare supplement, the Medicare Part D, the dental and vision, it's not uncommon for people to be paying anywhere from $250 to $400 a month, or maybe even more, depending on their age. Now with Medicare Advantage, this is a cost shift. There's that old saying, pay me now or pay me later. So with original Medicare, you're going to pay the highest premium, have the lowest out-of-pocket exposure, and freedom as to where you can go, no networks. Medicare Advantage is kind of the opposite. Premiums can be as low as $0 or a low premium, but you're going to pay copays along the way as you go, and there's networks to work with it. Now, these networks are usually pretty good, depending on the plan that you're on. They're not super restrictive. The networks can either be an HMO network or a PPO network. On an HMO network, you have to stay in the network to be covered unless there's a medical emergency. On a PPO product, it works to your advantage to stay in the network, but you have the choice to go out of the network, but you're going to pay more, and so is the insurance carrier. Now, if the insurance carriers on PPO products have to account for the cost of those out-of-network claims, therefore, in most cases, the benefits on a PPO plan tend to not be as rich as they are on an HMO plan. So HMO plans tend to prevail. Some people get scared off by the word HMO based on history, through the 80s where the networks were really restrictive. You had to go to a primary care doctor to get referrals to see your specialist. That's not necessarily the case with Medicare Advantage. These networks, there's some that are very big and national on HMO products, and some HMO plans do not require a referral from your primary care doctor to see a specialist. Medicare Advantage plans can still require prior authorization for certain services. Now with Medicare Advantage, you're going to pay copays as you go. And then those copays or co-insurance that you're paying as you go accumulate towards the maximum out of pocket. So it kind of works a lot like commercial insurance that people are accustomed to having through employers. Networks, max out of pocket spending limits, kind of pay as you go. So they're good for the right people, they just work a little differently. A good strategy that a lot of people are starting to go towards is using that Medicare Advantage with a low or no monthly premium compared to that high premium that they're paying for their supplements, their drug plan, their dental and vision. shift that to lower no premium on Advantage, and then you pay the copays as you go. Now the copays, there's smaller ones for a lot of the day-to-day things, and then there's bigger ones for the more expensive things. There's supplemental health products that exist in the industry that when the bigger copays come up, they pay cash benefits directly to you to help balance out that cost sharing on the Medicare Advantage plan. So the two products can be paired to work together. So would say Medicare Supplement, Medicare drug plans, and dental and vision premiums are up here. Medicare Advantage could be as low as $0. And then you take that lower no premium Medicare Advantage plan and add some supplemental health products around it. Depending on how you design it, those are usually between $40 to $100 a month, give or take a little bit. So then you're priced in here less than half, and you got a good solution. So if you would like to learn more about Medicare Advantage or supplemental health products to complement your existing Medicare Advantage plan, use the scheduling link, and that will set you up with a time to speak to myself or one of my agents that have been trained in my office to accommodate people on these things. I hope you have found this helpful, and if there's any questions, again, use the scheduling link to book a time and we'll get you taken care of. Thank you.